The referral source is broken.
I mean, there's always a fear that if you had a general dentist in-house, maybe some of your referrals would be less likely to refer because they would be afraid you'd poach their patients and not send them back. But it's interesting, like you said, as far as us being a referral source back to the general dentist, I get a lot of patients who come to me that maybe they're just missing a tooth or a couple teeth and they want an implant. And then I talk to them about the fact, well, I don't restore them, so somebody's got to restore it. We need to get you set up with a dentist. And that's when they say, well, I don't have one. I haven't had one in 6 years or 7 years. And then to look at like my community and say like, okay, well, these are the 3 people I would say go to them or try them, and then find out a lot of those practices, maybe they're already busy and they're not taking referrals. And to me, that's crazy to say, like, I'm sending you an implant patient and you're saying you're too busy for it. I mean, all you got to do is take the impression and seat the crown. Like it just doesn't, to me, maybe I'm wrong, but to me, that doesn't seem like a lot of work to get paid for a crown.
Well, there's oral surgeons that are restoring their own implant crowns. And so there are now periodontist oral surgeons that are doing their own all-on-X's and restoring their own all-on-X's with prosthetics, digital workflow. Have you guys thought about maybe just taking on the restorative side?
I've thought about it, only thought about it. Now, what I will do and do a lot of are temp crowns, just to form the transition zone around an implant. And then for all-on-X cases, I carry the patient up to, I think tomorrow I'm actually putting in a temporary prosthesis for an all-on-X. And I'll carry them up into the torque test. So implants go in, temporary prosthesis goes in. I evaluate form, function, and phonetics over the 3 or 4 months that I'm waiting for osseointegration to occur. See the patient back for a torque test. Everything looks good, feels good, sounds good, functions good. Off to the dentist they go, and we actually go to their office and we will help them do photogrammetry to scan and restore the case. So we try to provide a little added service in that regard. But I've actually gotten criticized by Facebook groups for doing temporary crowns on implants because I'm an oral surgeon. And I do think that people tend to forget that I am a dentist. I did go to dental school. I do understand occlusion. I know what a functional cusp is and working side. And all, I know what that stuff is, man.